But
because we got Dr. Jeff with us today. All right? Dr. Jeff knows the back. He's one of the great doctors on the Rothman staff. Dr. Jeff, what do you say, buddy?
Good morning. Thank you for having me.
Oh, what a pleasure, Doc. What a pleasure. We're here to talk about the back, and particularly, based off of Tyrese Maxey's back contusions. And, when we talk about a back contusion, some of the ways that you can sustain it.
Absolutely. So, unfortunately, it's a fairly common injury, but especially when it comes to a contusion, it can be varying degrees of severity, obviously. Typically, it's a blunt force trauma type of injury. So, a lot of times in sports, you'll see it, let's say football with certain tackles getting hit in the back, and then injuries for like basketball, obviously. Oftentimes you'll see guys coming off the rim or trying to go up for a layup or a rebound and end up landing on their back. And so obviously landing on the hardwood or any extent or getting hit, with that type of trauma can cause a lot of injuries to the surrounding tissues in that area. So there can be injury directly to the muscles there. There's a lot of structures, vascular, meaning like vessels that can be injured. And then obviously there's a lot of bony anatomy in that area as well. So not only can you injure some of the soft tissues, but also some of the bone in that area, some of the vertebrae and some of the other bony structures there. So that in and of itself can get injured. And that whole combination can cause a lot of inflammation, swelling, and then ultimately a lot of stiffness and pain.
You look like you play ball. Did you play ball, Dr. Jeff?
No,
you look like
I played rugby.
6'4" two guard.
I played rugby.
All right. So you know all about contusions.
There was a lot of generations ago.
All right.
But same type of thing.
Right. I mean, you took shots. All right. You took big shots. I love it. Doc, so what's the typical recovery time for a back contusion?
So again, obviously that'll depend on how severe the injury is.
Yeah.
For guys, it's funny. It's actually a situation where maybe if you had a little bit more cushioning, the recovery would actually be better. But, most of the guys we're talking about who are more elite athletes, they don't have much cushioning there. Yeah. It's all muscle. And so they don't have much to kind of cushion that fall between whatever hits them. Well, I won't comment on that. I think we all have some degree. But anyway, that's probably one of the things that determines it. Obviously, the degree of force plays a role. So, if you see a lot of bruising in the area, that can be indicative of more severe injury, or at least to the surrounding vessels. Obviously, you'd see a doc and, kind of get an evaluation. Is there anything outside of the area where the trauma itself was? When it comes to the back and the lumbar spine area, obviously there's a lot of nerves associated with that. There's discs in that area as well. So depending on the severity of the trauma or the injury, you could have injuries to the nerves nearby that could cause pain, numbness, or tingling into the legs. If there was a fracture because of the fall, that would really, implicate, other treatment options that might be needed, but also the duration of the time that you'd be looking at. But in most cases, it's typically a few weeks for improvement. The biggest thing initially is probably stiffness, along with swelling, inflammation in the area. So typically, we'll recommend rest. Icing the area can be very helpful. Compression, like a back sleeve or a back brace, can be helpful. And then some medications can be helpful too. So anti-inflammatories are good at reducing inflammation. Sometimes muscle relaxers can help with a lot of the stiffness in the area too. But typically a few weeks. If there's a fracture, it could be a few months.
Oh, wow. Anything preventative?
Well, again, we talked about the cushioning, so I guess if you wanted to add some cushioning there, that could help. Really not. I mean,
Yeah.
a lot of it is unfortunately how the injury occurs.
Yeah.
So, we're
Yeah, if
again, we're
you're
talking about
falling, you're
elite
falling.
athletes.
That's it. You
Yeah,
fall on the floor, you're
exactly.
falling on the floor.
Correct. And then especially, if you're falling from a height of a few feet because you're
Yeah.
jumping up to the rim, or, again, we're talking about typically elite athletes. You can't be in much better shape.
Yep.
So it's not really coming down to that as much as probably luck of the draw more than anything.
Dr. Jeff, what's your favorite sport other than rugby?
Football.
Football. I love it. I love it. You still got
Absolutely.
the smile from the parade. I see
Absolutely.
it. You got a great way. Now, see, this is a doctor with a great bedside manner, too.
Because doctors I'm scared sometimes of doctors, but I feel good if he came in the room.
Dr. Jeff comes in, you go, oh, great. I have good hands right now.
Yeah.
This is all right.
That's nice of you. Thank you.
Well, we love all you guys at Rothman. You guys are the best, brother. Listen, have a great weekend. Go Birds.
You too. Absolutely. Thanks for having me.
You got it. Dr. Jeff.